there's a moment most people don't talk about. It happens in the bathroom, usually in the morning, with bright light and a quiet house and nowhere else to be. You lean a little closer to the mirror than you used to. Not because you're looking for something, but because something caught your attention. Maybe it's the gum line above one of your front teeth. It looks lower than it used to. Or maybe it looks thinner, like the edge is retreating, slowly, quietly, without any real pain telling you it was happening. And you stand there for a second, brush still in your hand, and you think, has it always looked like that? Then you rinse, put the brush away, and continue with your day. Because it didn't hurt. Because you're not missing any teeth. Because you've been brushing for decades, and you're not the kind of person who ignores their health. And that's exactly what makes this so easy to miss for so long. Most conversations about oral health start with the dramatic stuff. Cavities, root canals, extractions, emergency visits. But what a lot of people experience and quietly carry looks nothing like that. It's subtler, it's slower, and for many adults it starts long before there's any obvious reason to worry. A tooth that's suddenly sensitive to cold when it never used to be. A soft ache near the gum line after you bite into something firm. A tiny amount of pink in the sink after brushing, so small you almost talk yourself out of noticing. And underneath all of it, a feeling that's hard to name, but very easy to recognize once someone finally puts it into words. The quiet sense that your mouth is aging. Not in a way you can fully explain. Not with any specific diagnosis. Just a slow, private awareness that things feel different than they did 10 years ago. That maybe your teeth aren't quite as secure as they used to feel. That maybe your breath isn't something you're fully confident about anymore. That maybe you avoid certain foods now. Ice water, crusty bread, cold fruit. Not because of any dramatic event, but because of a dull expectation of discomfort that crept in so gradually you forgot there was a time before it. If any part of that sounds familiar, I want you to know something first. You are not overreacting, and you are not alone. The reason so many adults over 45 experience these exact patterns together, sensitivity, recession, subtle inflammation, the quiet fear of losing teeth, isn't random. It's deeply connected to how gum tissue ages, how the oral environment shifts over years of accumulated habits, and how inflammation slowly changes the relationship between teeth, bone, and the delicate tissue that holds everything in place. And the frustrating part, the part that makes this genuinely difficult, is that it rarely announces itself loudly. Gum disease doesn't usually show up the way people imagine. It doesn't arrive as sudden, dramatic pain. It doesn't make you call in sick or rush to the emergency room. It tends to progress quietly, for months, sometimes years. A little swelling here, a little tenderness there. Gum tissue that slowly pulls back a millimeter at a time. So gradually the change is almost invisible until one day you're standing in the bathroom with better lighting and you realize the change is actually very visible. That's what makes it so psychologically disorienting for a lot of people. Because by the time they notice, a process has already been going on for a long time. And the fact that they brushed every single day makes it feel confusing, almost unfair. So the first thing worth understanding is this. Brushing is necessary, but it is not the whole story. Inside your mouth right now, there are hundreds of species of bacteria. That's not an alarming fact on its own. Most of them are harmless. Many are actually beneficial, but in certain conditions, the kind that develop slowly over time in most adults, specific strains of bacteria begin to accumulate below the gum line, in spaces a toothbrush cannot realistically reach no matter how carefully or consistently someone brushes. And these bacteria don't cause immediate pain. They cause inflammation, slow, low-grade, chronic inflammation in the tissue surrounding the teeth. And inflammation, over time, is one of the most destructive forces in the human body, including the mouth. It breaks down the connective tissue that anchors gum to tooth. It weakens the tiny ligaments that hold teeth in the jaw. It begins, very slowly, to affect the bone itself. And as the tissue becomes more inflamed and fragile, it starts to recede, to pull back, to expose more of the tooth's root than was ever meant to be exposed, which is why sensitivity often develops. The root of a tooth is not protected by enamel the way the crown is. It's softer, more porous, more vulnerable. So when the gum pulls away and root surfaces become exposed, temperatures that were never a problem before, an iced drink, cold air on a winter morning, the metal of a spoon, suddenly trigger sharp, brief, startling sensations that weren't there before. And if you've ever felt that particular kind of sensitivity and thought, where did that come from? The gum line is often exactly where the answer lives. Here's something that often surprises people when they first hear it. Gum disease is the most common chronic infection in adults worldwide. Not a cold, not a skin condition, not a seasonal issue. The mouth. And most people who have it, especially in its earlier stages, don't know. They think their gums are just a little sensitive. They notice the bleeding when they brush but assume it's because they're brushing too hard. They see the gum line changing and file it under getting older. And in a way, that last instinct isn't entirely wrong. Age does play a role. Gum tissue naturally becomes thinner and more delicate over time. Saliva production often decreases, which reduces one of the mouth's natural defenses against bacterial buildup. Immune responses in oral tissue can become slower and less efficient. But age alone is rarely the complete explanation. Because the adults who maintain healthy gum tissue well into their 60s, 70s, and beyond tend to share certain habits and certain awareness that most people were simply never taught. And one of the biggest gaps in that education is understanding that oral health is not just about teeth. It's about tissue. It's about the bacterial environment. It's about inflammation management. And it's about the invisible daily patterns that either support or gradually erode the foundation the teeth sit in. Think about what happens in the average day for someone in their late 40s or 50s who considers themselves reasonably careful about their health. They brush in the morning, probably for 60 to 90 seconds. Maybe they floss 3 or 4 times a week or remember to when they see the package. They use whatever toothpaste they've been using for years. They might use mouthwash occasionally, and by every reasonable measure, they're doing the right things. They're not neglecting themselves. But there are gaps in that routine. Invisible, ordinary, seemingly harmless gaps that accumulate quietly over years. The spaces between teeth where bacteria build up undisturbed. The area just below the gum line that even careful brushing doesn't fully address. The back molars that are harder to reach and get less attention. The dry mouth that develops while sleeping, which allows bacterial populations to multiply for hours without interruption. And these gaps don't cause problems overnight. That's the deceptive part. They create the right conditions for slow, steady, compounding change. The kind where 1 year you're fine, and 5 years later you're noticing things in the mirror. There's an emotional dimension to this that doesn't get discussed enough. For a lot of adults, oral health becomes quietly tied to how they feel about aging. Not in an abstract way, in a personal, daily way. The worry before a dentist appointment that turns into something more than just routine discomfort anxiety. The self-consciousness about breath that starts to affect how close they stand when talking. The way a loose tooth or a shifting bite can shake someone's confidence in ways they'd never admit to anyone. The social withdrawal that sometimes begins with avoiding certain foods in public. Hard crackers, corn on the cob, anything that requires a confident bite. None of these experiences are dramatic. None of them make headlines. But they quietly shape how people move through their lives. How freely they laugh. How openly they smile. How comfortable they feel in their own skin. And for many people, that erosion of quiet confidence begins long before any dramatic dental event occurs. It begins with the small signals that are easy to dismiss, but difficult, if you're honest with yourself, to fully ignore. The sensitivity that makes you hesitate before drinking cold water. The gum line that makes you look just a little longer in the mirror. The bleeding that you explain away even though somewhere in the back of your mind, it registers. One thing that research on oral inflammation has consistently shown is that the mouth and the rest of the body are not separate systems. They're deeply interconnected. Chronic low-grade inflammation in the gums doesn't stay politely contained to the mouth. It can affect the immune system more broadly. It has been studied in connection with cardiovascular health, blood sugar regulation, and systemic inflammatory load, which means that the slow inflammation people ignore in their gum tissue isn't just a dental inconvenience. It may be one piece of a much larger picture of how the body manages aging and chronic stress over time. And that's not meant to be frightening. It's meant to reframe something most people were taught to think of as purely cosmetic, whether their gums look okay, into something worth paying genuine, consistent attention to. Because the mouth is one of the earliest places where the body signals that something in the internal environment needs support. The inflammation shows up there first. The sensitivity shows up there. The recession. The bleeding. These aren't just aesthetic inconveniences. They're communication. So what actually happens to gum tissue over time, and why does it change even in people who are doing everything they were taught to do? Part of the answer lives in something called the sulcus, the tiny space between the tooth and the gum. In a healthy mouth, this space is shallow. The gum fits snugly, but when bacteria accumulate consistently at and below the gum line, the tissue responds with inflammation. It swells, it becomes more porous. Over time, the pocket deepens, and a deeper pocket is harder to clean with a regular toothbrush, which allows more bacteria to accumulate, which creates more inflammation, which deepens the pocket further. It's a cycle. And once it begins, it tends to continue unless something actively interrupts it. The bone underneath can eventually become involved. The connective tissue that anchors teeth begins to weaken. Teeth can become sensitive, not just to temperature, but to pressure. That mild ache after chewing a firm meal that you probably attributed to stress or fatigue. And the gum line keeps shifting downward, slowly exposing more of the root, changing the appearance of the teeth, creating that look of longer teeth that people associate with aging. Because the phrase long in the tooth is literally a reference to this exact process of gum recession. What's important to understand is that this process is not inevitable. It is not a fixed consequence of getting older. It is a response to conditions that, in many cases, can be meaningfully influenced. Some of the habits that tend to accelerate this process are surprisingly ordinary. Chronic mouth breathing, which often develops during sleep, significantly reduces saliva flow and dries out the tissue, making it more vulnerable to bacterial damage and more prone to inflammation over time. High sugar and highly processed diets feed the specific bacterial strains most associated with gum disease while depleting the nutrients gum tissue needs to maintain its structural integrity. Chronic stress, the kind that millions of adults carry as a background condition of modern life, increases cortisol levels, which can suppress immune function in oral tissue and accelerate inflammatory processes throughout the body, including the gums. Medications for blood pressure, anxiety, allergies, and dozens of other common conditions list dry mouth as a side effect, and dry mouth consistently creates conditions that favor gum inflammation. And grinding, which many adults do unconsciously during sleep, especially during periods of stress, places enormous and repetitive mechanical pressure on both teeth and gum tissue, contributing to recession, sensitivity, and the kind of subtle jaw tension that people often attribute to stress without understanding exactly how it's manifesting. None of these factors announce themselves dramatically. They accumulate, they interact, they create the slow, compounding picture that one day shows up clearly in the bathroom mirror. The encouraging part, and there is an encouraging part, is that gum tissue is more responsive than most people realize. Unlike bone, which has limited regenerative capacity, gum tissue can respond meaningfully to changes in the oral environment when those changes are consistent and intentional. Many adults who begin addressing inflammation, bacterial balance, dry mouth, and nutritional gaps in oral health report noticeable improvements in gum comfort, sensitivity, and even changes in how firmly tissue sits around teeth. Not overnight, not dramatically, but gradually, the same way the damage accumulated gradually. The body tends to respond to the same slow, patient consistency that the disease used to develop, and some of the most impactful changes are not complicated. Improving hydration significantly affects saliva production and the moisture balance of oral tissue, supporting the body's natural anti-inflammatory systems through diet, sleep, and stress management, reduces the inflammatory load the gums are constantly managing. Addressing the bacterial environment below the gum line, not just the surface of the teeth, is what many oral health specialists consider the most important shift for adults dealing with chronic gum issues. Because if the bacterial environment doesn't change, the inflammation doesn't change. And if the inflammation doesn't change, the tissue continues to respond accordingly. There is also something worth saying about the relationship between oral health and self-perception that rarely gets acknowledged directly. For many adults, having a healthy, confident mouth is tied to something much larger than dental hygiene. It's tied to how they feel in social situations, how comfortable they are with intimacy, how freely they express joy without calculating where their lips are positioned, how secure they feel when they look in the mirror, and when that comfort starts to erode, when sensitivity limits what you eat, when recession changes what you see, when the worry about your breath starts shaping how you interact. It affects quality of life in quiet, but very real ways. This isn't vanity. This is the reality of living in a body that is always communicating and trying to understand what it's saying before the conversation becomes harder to manage. So if any of this has landed as recognition rather than just information, if you found yourself thinking, yes, that's exactly what I've been noticing, or I never connected those things before, or even just, I've been pushing this to the back of my mind for a while, then the most important thing you can do right now is simple. Pay attention. Not with panic. Not with a sudden urgent overhaul of everything, but with the kind of calm, consistent, honest attention that the early signals are asking for. Notice the sensitivity. Notice the gum line. Notice the bleeding, however small. Notice the dryness. The discomfort, the subtle changes that don't quite fit the story of, I brush every day so I'm fine. Because you might be fine. And I genuinely hope you are. But the body has a way of rewarding the people who listen to it carefully, especially the ones who listen before the whispers become something harder to ignore. Toward the end of this video, I want to mention something briefly and gently. If you're looking to go further, if this resonated and you'd like to explore some of what's available in terms of natural support for gum tissue, inflammation, oral comfort, and healthy aging in the mouth, there's a resource in the comments below that some viewers have found genuinely helpful. It's not a replacement for dental care. It's not a dramatic claim or a promise of a miracle. It's simply something worth knowing about if you're in a season of life where you're starting to ask better questions about what's happening in your mouth and why. Check the link when you're ready. No rush. No pressure. The fact that you watched this far already tells me you're someone who takes this seriously. And that's exactly the kind of attention your health deserves. Take care of your mouth. Not because of how it looks, but because of what it's connected to. Your confidence, your comfort, your daily relationship with your own body. The signals are there. They've probably been there for a while. The only question now is whether you decide to listen.